So welcome everyone today to another Times conversation, and today we are talking a very interesting and yet important topic, I think which has been ignored for a long time. And let's begin with admitting the fact that men and boys closer to home in India are not all right. I think let's begin with admitting that fact before we start this conversation. And this is all proven in statistics. There's a lot of data around it, which is known through different surveys, through different statistics, everything. For example, one of the interesting statistics which I recently came forward is around the entire manifestation of, let's say, mental health. And mental health is a combination of multiple things. It is a combination of clinical problems, it is a combination of psychosexual problems, a lot of those. And the when the stats came, they were quite surprising and revealing. While there is a lot of mental health problems associated with females, there is enough and more problems associated with males. Now, while females may have more anxieties, depression, and mental health issues, the manifestation surprisingly was much higher in male population, and the aggressive manifestation was way more higher, which finally has resulted in a lot of suicides among men. And that's as serious an issue as we can get. And today we have a panel which is actually trying to solve some of those issues. We have a hospital which is taking a leap in solving some of those problems and bringing it to the forefront rather than shoving it under the carpet. And I think today the kind of panels we have: Dr. Ghouse, who is a esteemed urologist; Dr. Suraj, andrology; Dr. Philip, psychosexual wellness. All of them are stalwarts in their field. And more than anything else, let's begin with acknowledging and kudos to them to solving some of those problems, which, again to repeat, have more often than not been ignored. And it is high time we bring it to the forefront and solve some of these problems. So welcome, doctors, and it's a pleasure to have you today for this important subject and this important conversation. So let's begin with something which is very interesting and important. So men feel problems, but more often than not, it is so hard for them to talk about their problems, their needs, and a lot of them are very strongly. So there are quite a few which are non-clinical, and there are quite a few which are actually clinical, which are solvable. But the problems are not brought to the forefront. Questions to you, and maybe Dr. Suraj, we start from you. Why are these problems not coming to the forefront? Why are men not coming to talk about it? And extension to that, what are some of the clinical signs which they should not ignore while talking about some of this? So maybe we begin with you, Dr. Suraj.
So it's a very important topic which you bring up at the start itself. Why don't they come out? Now, a lot of patients come to us in our OPDs with sexual issues or infertility issues, which had a basis probably in their childhood. Now, the reason they bring out that why they did not approach us earlier is that they were not aware that it is an issue. Okay. So, second thing is there was no discussion within the family that there are such things which need to be looked into. And the third most important part, which is, I mean, common for most of the men worldwide, is probably their ego regarding discussing sexual aspects. So this is what commonly the men in my OPD come and tell me, that these are the reasons why we didn't approach and we were not sure that whom to approach. So these are the common reasons why they don't reach out. Now, what are the warning or the early symptoms which they should not take lightly? First of all, there are some emergency situations like probably severe testicular pain. Maybe it usually happens in the younger age. Young boys with testicular pain, very severe, with a swelling, probably it means that there might be some emergency going on there and it needs to be looked at immediately within few hours. Other common issue which is an emergency in the young male or in the young adults is something known as prolonged erection or priapism. Now this again is in the sexual age group kids. Now, this situation requires emergency treatment as well. After this comes down few other symptoms, which we commonly see as simple thing like a urinary tract infection. Any UTI in a man needs to be evaluated. It might not be related to the fertility at that point, but down the line it might affect his fertility as well. So a UTI, simple thing as like that also needs to be considered a warning sign, and they should come for early checkup. The other symptoms like difficulty in maintaining an erection, premature ejaculation, all these things may happen to someone in some part of their life, but at the same time, it doesn't mean that one episode of these things means they have to rush to the a doctor. Usually, we suggest that maybe a prolonged time of 3 months or so till they understand their problem is universal. It was not a one-off time. That is when we think that okay, they should consider it as a warning sign and come to us. So these are the early things which I would like to bring out. Which
What I feel is men, as you have been seeing, is a symbol of strength. Is a symbol of leading the family. That is probably one of the main reason they don't come up and speak. Because anything if they speak on their own sexual health or their own deficiencies, if they call it, rather than the the ego or something, but it's the inhibition that they have. They are supposed to be the strongest, supposed to be the leader. If they come up with some illnesses, they feel they are insulting themselves. The guilt of saying that they are ill in whatever form it may be, in the form of ill health and the form of sexual health, whatever be it. So that is one main inhibition which don't let them come out and speak openly about what they are having. That's one very big inhibition.
That's interesting. And Dr. Ghouse, is it common across all social strata and segments, or do you think there is something which is
In every family, see, if the child has some fear of something, he approaches the mother.
correct?
The mother approaches the father.
Correct.
So the father or the male character in the family is known as the leader of the family.
Yes.
So that sort of an image is already there in the society, and that stays in every family depending on whatever strata they come from. So that is one thing which holds them back in telling out to a doctor or telling out, discussing with their own family members or peers regarding their own sexual health or their own weaknesses.
So when it comes to when it comes to sexual medicine, generally males are a little hesitant to discuss it because, as rightly said by two panelists, that it's linked to masculinity. Nobody wants to express that they are having problem in sexual life. More so, the way to approach, whom to approach, is also a bigger concern in India, because many times it's your colleagues or your friends who are the first person whom you approach. And unfortunately, we don't have a sexual education per se, where people are being taught about what is a sexual problem, is it a problem, is it just a normal variation. So when friends give suggestions, it further adds to their anxiety, and they start worrying about it, and it's a perpetual cycle where they start overthinking and making matter worse. If they go to help, apart from friends, the first thing they go to is to a local physician who may not be well versed with sexual problems, and then they start some treatment which may work, which may not work, and the problem persists. Only the later stage is when they approach experts like a urologist or andrologist and the psychologist. So I think we need to work on the grassroots level, where sex education in school is an important aspect, where men should also be taught about what is the normal sexuality, what are the different challenges at different stages of life, and should approach the right at the right time.
Absolutely, what he said is absolutely true. When he discusses, first is their friends or the peers or the office mates. Sometimes this discussing itself can be productive, can be counterproductive. Because if they themselves bully him, if the thought of him getting evaluated itself dies down there.
Absolutely.
So, in a way, it might encourage him. Some sensible person in the family might suggest him to go to a doctor, but some people in the peers might make it, as a gullible thing, and he might not do it also. So, it's a counterproductive thing. And as you say, rightly said, they might go to a physician who might not be aware and it might not be dealing with this sort of a scenario on a regular basis. So, it might be counterproductive in that situation also.
Interesting. And a follow-up question to maybe all of you. The problem obviously has always been there. Do you see any change with the entire technology and GPTs and everything at the disposal? Do you see there is some shift in terms of awareness which is coming around for good, or do you think that things continue to be the same? Because obviously, so where I'm coming from is the digital times actually helping in some of those getting to the forefront than it was earlier, when you could just talk to your colleague or friend or anything? Or is it there is a still a huge gap in terms of, there might be a huge gap still, but is the gap bridging with technologies, or it continues to be the same? Anything that comes to your mind, any of them?
Yeah, so definitely chat GPT and all the AI technologies, the Google search itself is giving the patients a very good idea at the upfront when they search it immediately. And I've seen that in my OPD also as well. So patients definitely bring it out themselves that I searched my symptoms online and it said so and so. And nowadays I'm noticing that it aligns with my thought process as well. So definitely there is some alignment visible with what the AI's output is coming out as and what clinically we are feeling. Sometimes there is alignment. Earlier it is not be that much, but definitely that change is visible.
Yeah, because one of the things which you said was, some subtle indicators. So, I mean, for subtle indicators, people think that, okay, why go? But then when you put in those subtle indicators, what you are actually saying is some of these tools are helping bring that seriousness in some of those subtle indicators which they might notice.
I put it in a way that it creates good amount of awareness.
Awesome.
At least to know what he is having, he can, if he is not able to share with his peers or his family members, at least he is sharing with the internet. And the internet is guiding him in creating an awareness that you have some problem or you have a symptom which might require some attention. At least that sort of an awareness, if at all it is creating, it is definitely useful. On the other spectrum of it, it might get lead to a situation where he himself medicates, he himself gets few evaluations done which are absolutely not required.
Absolutely.
There are people who get all hormone and evaluation that is supposed to be done to a female, and they come because they got it online.
Oh my God. Okay.
So all these things happen. Definitely, it's very useful on creating the awareness, but not to individualize to that particular person's problem.
No, absolutely, absolutely. And I think some of the roles which are playing there, I think the awareness layer is good, but in terms of what after that, I think people are talking about some of these terms and generative engine optimization, where actually people are able to find doctors from GPT or LLMs who can actually help them solve some of these, at least in terms of the specialities and the hospitals where people go to seek help.
I would say that this is a double-edged sword. At certain points, it's useful definitely for creating awareness, but more than that, people nowadays type their symptoms and then they get a whole host of diagnosis. Especially in my field, psychosexual medicine, we feel that most of them have a lot of anxiety about their performance. And if you go on the net and check, it's going to want to increase your anxiety rather than clear your doubts. And we find that patients who have this state of overthinking, overanalyzing, they are the one who are the first to approach AI and do. So it's more counterproductive for them. I'm not saying it's a bad tool, but it's a double-edged sword. You need to know how to use it. You need a clarification for yes, but you can't completely diagnose and depend completely on AI. And many patients who come to us have already known what they have problem, treatment and all. They just want to reassurance from me. But when I tell them this is what it is, no, I know already AI told me this is what it is, but you tell me what exactly you want me to do. So it's a double-edged sword. You need to use it the right way at the right time.
Awesome. So now that we have talked about awareness and understanding symptoms and all, I think for a lot of people and especially for readers, I think it is very important to bring to light of what each branch is all about, maybe, because and tying to it, will be a follow up, because all three of you are sitting and we have that luxury today. How is everything tying in together? Because I don't think a lot of readers understand. Andrology derived from the word andro, obviously is like intuitive, but what it actually does, and what is andrology, what is what is psychosex. I think let's talk about it for a minute and then revisit on some of the solutions which all of it brings. So maybe
Yeah, so I will first of all, I mean, andrology, urology, both are same actually in a way. Now, urology is in India, it's a specialty. After completing medical school, you go through training into general surgery, and then you complete 3-year course in super specialty course in genitourinary surgery. So after that, there are subspecialties in urology. Out of that, one of that is andrology. Now, urologist will look after both men and women as well as males' reproductive issues. Andrologist is a urologist who has focused or specialized mainly into the andrology aspect, that is the male reproductive issues and male sexual dysfunction and infertility issues. So that's what urologist, in a way, all urologists are andrologists, but andrology means little bit focus on probably the male sexual dysfunction and reproductive health.
So basically, I am a robotic surgeon, a urologist.
Absolutely.
I do a lot of laparoscopy.
Mhm.
But my play as an andrology, helping a patient who comes with an andrology symptom, is to evaluate and guide it to a person who is having a special interest in andrology.
Okay.
Though we are trained in urology to tackle andrology, but my special interest might not be in andrology. So we have a group of doctors in our own setup where they have a special interest in andrology. They're specializing in dealing with this sort of patients. So that's my area of interest. And also, there might be some surgical intervention that might require for these andrology patients. That is where I come into play with the minimal possible discomfort, minimal access technology that is available. There's robotics and laparoscopy, then minimal scar surgeries, microscopic surgeries. So these are all the things that we, as a urologist, surgically we treat those conditions if at all they are linked to the sexual health of a patient. Majority of them might not require it, but whoever is required, surgically we can correct those.
Okay. So psychosexual medicine deals with the psychological aspects of the illnesses. So any medical condition you take, for that matter, sexual condition, always there is an underlay of psychological factors, anxiety, depression, misconceptions. So we deal with predominantly with addressing the psychological aspects of the illness. After psychiatry, we do a post course, 6 months course in sexuology. That's how we deal with them.
So that's interesting. Now, a quick question. Let's say, again, from the reader's point of view and, the layman, let's say if there's something which they feel in terms of, let's say, discomfort or fluctuation or some symptoms or even low energy levels throughout the day, etc., at work, all of that, how should they go about it? I mean, where should they go? What should they think? How should they approach this? Who should they go to? I mean, so the idea is obviously to have a complete integrated care, and it may be like Dr. Ghouse, you said, something as serious as requiring or let's say something requiring a robotic surgery. Why say, as serious? But how should they go about understanding and approaching and seeking the right help and going to the right people? What should they do and how should they?
The first instance, he feels that he has got some sexual problem or a problem that might be related to his sexual health. He needs to visit a urologist.
Mhm.
The urologist probably will segregate it into whether he has got some organic problem, whether he has got some psychosocial problem, whether he has got something that needs to be evaluated and treated with medicine.
Okay.
So that evaluation is basically done with it.
Okay.
Later on, if he requires more of a anatomically he has not got any pathology, there is no anomalies that he has got, congenital anomalies or any major developmental anomalies since childhood that he has not noticed, because these things are all concealed.
Correct.
Might not be evident outside. Having an extra finger is an anomaly that everybody can see.
Correct.
But not having a testis in the scrotum is a thing which is not a thing everybody can understand. So that examination is done by a urologist. A basic few tests or hormonal evaluation is done by a urologist. Physical examination, hormonal evaluation, and a few set of questions where we can get out whether it is psychologically involved in this issue or he has got some medical condition that needs to be treated with medicine, hormonal evaluation, or a surgical intervention that is required. So depending on that, then we segregate the patient. We send him to an andrologist if he requires problem for his erections, if he has got infertility, if he is not able to get an erection but maintain an erection for a long time, all these things, then andrology will evaluate further. If he has got mainly a kind of a depression, because brain is the most important organ for any psychosexual activity to happen, then we refer him to a psychiatrist or a person who can counsel him as to get out of this depression or his mental state. So that's how he's supposed to go to a urologist, and he's going to probably help him out.
No, that's great. That's interesting.
So you brought out about low mood, generalized weakness. Like those symptoms can mean a lot of things. It doesn't directly push a patient to a urologist, but if there's an overlay or underlay of sexual issues, or there is infertility which is in their mind, which is whatever is the underlying additional urological aspect is there, definitely they should meet a urologist. But also it should also we should understand that these symptoms can arise because of general cardiac issues also. If someone suddenly was having a good exercise tolerance and now he can just walk probably 100 meters, getting breathless, weak all the day, he should probably consider getting a full body checkup or meet a physician or a cardiologist. At the same time, if they have something known as like subject is there like depression. Now depression alone can cause all these symptoms. It doesn't have to have sexual aspect to it, but patients with sexual issues, they go down that lane where they go into depression because of their sexual issues. That is where we as a group can work out and help them more.
No, interesting, and I think the way, at least till now, the conversations have. This is much deeper science than it comes to the eyes.
Oh yes.
And this is obviously much deeper and much complex in its own might than what you see, if what comes to forefront. Doctor, so a question to you: how common are some of these male reproductive challenges, and what are some of those issues or major causes of some of these which you are seeing today? I mean, nobody wants to be in a position where they are sick or have some of these challenges, but what are some of those causes contributing, and how common are they in these times? Are you seeing a much increased incidence? Is it attributable to some factors, or what is going on here?
So male reproductive issues is a very broad topic. Now from the simple thing like a foreskin issue to infertility, everything is something related to the male reproductive health. Now most commonly we see patients coming with simple issues like foreskin infections. They don't know how to maintain good hygiene, and they have issues related to difficulty in pulling it back. Now that causes discomfort. If infections, this can cause sexual discomfort, or they call dyspareunia, and it leads to in long term it can damage the urine pipe, and can cause permanent damage to the whole urological system, and renal kidney damage also is a possibility in those situations. So a simple thing like a foreskin problem should also not be left behind. But the other side of it is the infertility aspect. Now infertility may have many factors which lead to a man to the diagnosis of infertility. Now it doesn't mean that the man himself is infertile. It is usually the couple who is infertile. We don't treat the man separate and the woman separate. Only a couple who have come to us saying that they are not able to conceive or they are trying to conceive, we consider them as a couple, as a patient usually. So the infertility aspect for them can be a male factor or a female factor. Now for the male, I mean, usually scientific literature has proven that in 50% of the cases of infertility, the man has some role in it. So it doesn't have to be completely the man's issue or the completely the female issue. Sometimes it's a compatibility issue between a man and a woman as well. So right now, for male reproductive health and infertility, the major factors which we are seeing nowadays causing these issues is the lifestyle issues. So the most common is our general obesity issues, sedentary lifestyle issues, not having a good diet, absence of physical activity, not having good sleep, chronic stress, all the time on devices. All these have a negative impact on the body hormonal milieu. So that itself can affect the hormones production, the hormone levels in the body, which are required for testicular functioning and fertility aspects.
Sure. And Dr. Ghouse, in your experience, how many of them have you seen actually? I mean, let's say there is a cohort of, let's say, 100 patients or so, just for simplicity. How many of you are seeing that it gets so severe that it requires some kind of a surgical intervention?
Surgical intervention is the last thing to be done in andrology. but definitely a part of it.
Okay.
But if you consider having many other problems which might not require a surgical intervention, every third person, every third male has some other relation to a psychosexual or a sexual inability.
Okay.
Like you can call it a ejaculatory dysfunction or erectile dysfunction or some sort of an hormonal imbalance. So every third male has this problem. But that leading to an infertility, almost 50% of the males have that issue.
Oh my God. So every three, and out of those three, every 50%.
So we need to evaluate those people. Part of it, majority of it probably might get relieved by just counseling. Then a few of it might get relieved by some medical therapy itself. And then last comes the surgical intervention. In andrology, surgical intervention is very minimal, but when it is required, that changes the entire spectrum.
Interesting. Okay, doctor.
So,
How about your patients? You are seeing?
When it comes to psychosexual problems, like I said, it all depends upon the person's sexual development right from the childhood. So what you have been fed in the childhood shapes your future sexual life. So that's the reason why the emphasis is on providing quality sexual education in the early teenage. Many of the patients who come to us may not actually fit into a diagnosis of an illness. They just have a concern about the sexual life. Many times there's wrong information from watching on net. Nowadays, porn addiction is very common. People watch porn and they form their own views about how long the erection should be, how strong the erection should be, and how long the partner should be satisfied. So they have a lot of misconceptions in that coming out of this thing. So many of us who come to us generally need a assessment and then try to understand what misconceptions the person is carrying, because this will add on to the anxiety and ultimately the sexual problems. So I think a good sexual education is what is the need of the hour, and more and more it's included in the curriculum, that's better.
One of the questions again, as a follow-up, Dr. Philip, I have in terms of the patients who come to you, how many are there who are impacted by emotional health, which is actually leading to some of these problems? Is that becoming a big chunk which you see, or how is it manifesting? What is happening? Because I think see those patients much more closely than any of us do.
So basically, because I'm a psychiatrist, so almost all of them who come to me are basically having some psychological problems. So almost 80% of them would have some issues. Patients who have psychological problems, as a part of it, can have sexual problem. Patients who have sexual problem, because of sexual problem, can have depression or anxiety. So it's an interplay of both things. But a majority of patients who come to me do have psychological issues.
Okay. That's quite interesting. Now, coming back to the entire clinical aspect of it, in terms of past versus present, what are the kind of modern medical innovations which are actually helping alleviate or cure or treat some of those symptoms? Have we advanced much more? And if you can touch upon some of those, modern treatment practices, or modern, if you say robotic surgery or some of those, like, how is it helping? And I understand some of these may or may not be directly life-threatening in a matter of in quite a few cases, but there's actually a lot of cure which might be there right now, which was not there. So maybe some modern clinical interventions, if both of you can throw some.
Technology has advanced enormously, exponentially rather. Probably 15-20 years back, a simple hormonal test would take a 3 days time to get out. Now we can finish it off in 10-15 minutes. You have a auto analyzer, you just put in a drop of blood, you get out the reports. So in every aspect it has added, not only in some technology, but starting from the evaluation part. You have got high resolution ultrasounds, you have got Dopplers, you have got tiny things that can be picked up in real time. You have got MRIs, high resolution MRIs, you have got 3 Tesla MRIs, 3.5 Tesla MRIs. So this, not only in imaging, not only in evaluation, even you have got genetic evaluation that is available of the cell. We just need to write a genetic evaluation, you'll get a panel of some 25-30 genetic tests that can be done just with a drop of blood. All these advancements have come up where the evaluation has become very easy and very fast. Previously, this evaluation used to take days together to come to a conclusion that what exactly this patient is having. After this is done, supposing you need to do some intervention, the kind of microscopes that were available few years ago have drastically changed. Now we have got miniaturization of those microscopes as well as betterment in the resolutions. You have got 4K, you have got HD, Full HD. So with better magnification, you can see better. When you can see better, we can operate better.
Absolutely.
So these all things have come. You've got 3D in it now.
Mhm.
You've got robotic precision now.
Mm.
You've got intuitive robotic precision with a 3D, visualization of what you're doing. All these things have added incrementally at every stage of the evaluation and treatment of any patient as a whole.
Interesting. Very good.
So, for any andrology aspect, I mean, andrology, as I said, caters to two main groups. One is infertility, one is male sexual dysfunction. So, the infertility aspect, what is new is the new evaluation part, which Sir has already brought out. We are doing faster evaluations. There are now AI-assisted semen analysis option. Now that picks up simple aspects. I mean, the detailed seminal aspects such as motility, shape of the sperms, all these things in a more detailed and quicker way. Normally it takes half a day for the report to be prepared. Now it comes within minutes, and it is quite accurate as well. So apart from the evaluation part, the technologies are new technologies have come, but the backbone of andrology is usually lifestyle. So correction of the lifestyle is what we should emphasize on first.
Sure.
That is, after that, if those fail, then there are a lot of technologies to correct the surgical aspect, and there are some newer techniques to help the patient recover from their health issues, such as regenerative medicine. So what happens is, all the therapies are aimed at improving the quality of life. Now if someone has a poor erection, we want them to get a better erection, maybe with medication, maybe with lifestyle changes. Medication is a temporary option. It will work for a temporary period, and once the effect is gone, maybe they will be back to their previous self. So the long term is the lifestyle changes, which will correct their underlying causes, hormonal issues, whatever the metabolic issues, if they are obese, all those aspects will correct and give them a lasting corrective answer. Coming to how the newer technology of regenerative medicine comes here, it helps these patients regain a better vascularity in their sexual organ. There are techniques such as shockwave therapy, which are just recently been brought into mainstream medical management, where we have an option of allowing them to go back to a situation where they don't require medications down the line. So rather than giving them a temporary relief, we give them a cure for their underlying cause. So a lot of work is going on in this regenerative medicine, but very few options are actually practically available in practice right now. But in the coming years, many of these newer therapies will develop and might be incorporated.
Interesting. Dr. Philip, in terms of some of the non-invasive part which you actually deal with, how, I mean, there would be two aspects, obviously. One, again, the technology part of it, which I think doctors touch from a clinical perspective. Maybe there could be something from a non-clinical perspective also, and some of the newer therapies which, so do you see, what are some of those, if you can just...
I think sir, I've covered almost all the
Sure.
things. Nothing left for me to add to that.
Okay.
But then, yeah, better diagnostic techniques available now. And in terms of psychosexual medicine, better newer drugs have come now. For decades, when we could talk about erectile dysfunction, we knew only about one drug, that is Viagra. But now we have a couple of them, more medicines which are less side effects and better response rates. So in terms of this thing, I think better medicines are available now, which is less side effects and better results.
That's nice to know. Otherwise, you only know the advancements happening in Ozempic and Wegovy these days. It's good to know that there are advancements happening in other fields as well.
Yeah, we have medicines now for erectile dysfunction, newer medicines for premature ejaculations. We have medicines to increase the desire. There is a medicines to improve your sexual desire also now. So there are a lot of medicines, new medicines in sexual medicine field.
Interesting. Coming to a different topic, I know you guys are pioneers in terms of taking some of these leads, and we know very little about this entire Strong Men Get Checked campaign which is happening around that. So I think that is one initiative to push the envelope further to get people aware and to get themselves checked and all of. Can you both of you throw some light around it? What is the campaign all about, and what is happening there?
Well, as per our discussion, which is already going on, we brought it out. I think quite clearly. It's the man who doesn't want to get himself checked is what is causing the issues. Now that strong men, we suggest for strong men we mean mentally strong. What we want to suggest is that if someone is having any issue, be it sexual or related to infertility, they should get themselves checked. It is not about coming and getting a screening test done or some blood test done just for the sake of it. It is just to give the information out so that they know that there is help available, and it is just to maybe give them the idea that there is a good option here. Then their issue is something which they should not suffer with in silence, and they should come out with their problems. So that's the main aim behind the motto that strong men should get checked. It's not to just to get some tests done.
Okay.
Absolutely, as we discussed, why don't men come out and discuss their own issues? So this is one sort of an awareness that we would like to create, wherein we want them to come and discuss those issues, whatever small be it. But like how a female can go to a gynecologist who is considered as a lady doctor, but there is no male doctor.
Correct.
So that is the awareness we want to create. They can go and speak up rather than discussing with their colleagues or their peers, where it can be, as we discussed, counterproductive also. They can go and discuss with a person who is a specialist in that kind of a field. So that is the awareness we want to create, so that whatever small problem they have, they can talk it out, they can express these feelings, and they can get treated.
Interesting. I know we touched upon briefly a topic, but given the times which we are living in, I just wanted to touch upon it in a little more details in terms of how is some of the newer AI technologies helping you in this, in this entire space or domain. I mean, we just skimmed the surface maybe, but in your practical viewpoint, how is it helping you?
As you said, in the recent past, we had a case wherein multiple semen analysis, generally semen analysis is done with a microscope, with a pathologist seeing how many sperms are mobile, how many are good, how many are not mobile, how many doesn't have got, don't have a head. There's many anatomical factors that are analyzed by a pathologist. So doing himself as a human, analyzing all these samples versus doing it, giving it to a machine, and that with a better precision, with a quicker result, being able to do it in a mass scale. So that has drastically changed. So there are infertile couple where pathologist has given multiple samples and showed there is azoospermia. There are situations. Though it is anecdotal, might not be a norm. There are situations where AI has picked up few sperms and the patient could conceive.
Very nice.
So those kind of advantages definitely are there.
That's actually great to know.
Oh yes, recently we had a case wherein infertile couple for almost 8 to 10 years been giving trying for IUIs and IVFs. All the while not a single sperm was healthy enough to cause an ICSI, but with the help of an artificial intelligence they could pick up few sperms in whatever sample they got, and that was the reason for fertility.
Wow, that's really a cutting edge advancement.
Yeah.
I don't think it would have been possible.
10-15 years back, yeah.
Anything you would like to add?
Well, as of now, AI in andrology, it's mainly in the evaluation aspect. In treatment aspect, there's not much role.
Sure.
As Sir has brought out in semen analysis.
So this is great. I think what all of you have highlighted, this is as much as a science and a lot of hope for future. At the same time, a lot of information. Given the times we live in, there's a lot of information available. It's just that we use it to our benefit and get help with the entire science, whatever it has to offer us in recent times, and the treatments, the accelerated treatment and better treatment options, all of those. So thanks all for being here. I think we are also coming up on time, but this was a great session, and thank you everyone for bringing some of these topics to forefront, which again, to repeat myself, are normally not brought for whatever reasons.
The pleasure is all ours, and thanks for hosting us.
Thank you.
Thank you.